Did you know that people can have extra teeth? Here's what you need to know. Time for some PFOing so you know where you're going. Welcome back, everybody. I'm Dr. Ryan Packard, your local orthodontist at Packard Family Orthodontics. I can't see you, but glad you're here. Today's episode is inspired by individuals that I have had the chance to see who have extra teeth. What? Can you believe that? More than just the normal set, they have extra teeth. And we're gonna talk about what that means, why this happens, and how do you know if you have extra teeth. Finally, we're gonna talk about how do you take care of extra teeth, or what you should do if you have extra teeth. There will be some examples along the way, so I hope you enjoy these images. And before we get started, be sure to give us a thumbs up if you like this video. Leave a comment down below if you have a question about extra teeth or some other orthodontic related issue, or maybe just because you had extra teeth and you can say how your experience went handling it, how you figured it out. And finally, consider subscribing to the channel so that I can open your eyes to the wonderful world of straight teeth and beautiful bites. Okay, so what does it mean to have extra teeth? Well, when we have all of our baby teeth, when an individual has all of their baby teeth, all right, that means that they should have 10 total baby teeth on the bottom and 10 total baby teeth on the top. 10 plus 10 equals 20. Okay, 20 baby teeth. That's usually the amount of baby teeth that everybody has, the normal complement of baby teeth. All right, now when you get older though, you get your permanent teeth. Generally speaking, if you include wisdom teeth, then that means that you, and we're gonna split this up into like a cross, my mouth, like this, okay? The reason why I did that is because basically we've got 4 quadrants in everybody's mouth. Everybody's mouth has 4 quadrants. Up here, down here, down here. Here's the middle, all right? We split them up. In each quadrant, right, with wisdom teeth, you should count 8 teeth, right? Starting from the center, we call those central incisors, and then you move laterally or to the side, and you count all the way back to the molars, and you should have 8 teeth. So, and when you add that up, 8 plus 8 plus 8 plus 8, 32, all right? 32 teeth if your wisdom teeth have come in. But most people don't have their wisdom teeth come in. They either have them taken out, or they don't have enough space, so they stay in their bone, all right? If we get rid of wisdom teeth, and we just count all the teeth all the way back to our 12-year molars, then we have 7, 7, 7, and 7 teeth, to a total of 28 teeth, all right? So that's what's normal. So if you have extra teeth, all right, some people, what that means is that in addition to the 8 total teeth that an individual might have, including wisdom teeth, an individual might develop an extra canine, or an extra premolar, or sometimes an extra molar, like an extra wisdom tooth. It's crazy. So I've seen individuals that have 4 molars instead of just 3. Or I've seen individuals, as you'll see in these images, with multiple premolars. And extra teeth literally means that you have extra teeth. Do you need all those? Not necessarily. All right. In fact, sometimes extra teeth can interfere with normal tooth eruption. As the teeth develop and they come into the mouth, sometimes they can get in the way. Extra teeth can get in the way or block normal tooth eruption so that the permanent tooth can't come down into place. Obviously, we don't want that to happen. And we're gonna talk about how to take care of it in a second. So why does this happen? Well,
tell me all you know.
As far as exactly why some people get extra teeth and most people don't, we don't have a solid understanding about that. Well, how would you know if you had extra teeth? So the first person that would likely identify an extra tooth would be your dentist. So if you're making your regular visits, there's a good chance that they would be able to identify any extra teeth that you might have. Sometimes though, based on their x-rays and the x-rays that they take, they may not catch that. And the orthodontist and the dentist, they work together in tandem to try and help identify if there's any extra teeth or missing teeth or just abnormalities. So again, staying close to your dentist, coming to visit your orthodontist at age 7, right? Somewhere between 7 and 8, gives us a chance to see how the teeth are developing and see if we have any extra teeth. Here's an example. We had an 8-year-old patient, or close to 8, that was missing permanent central incisors, the big teeth in the front, right? They're missing it, and they're 8 years old. And everybody's like, what's going on here? How come these teeth aren't coming down? You guessed it, extra teeth. Extra teeth that you can see in this x-ray that are likely likely preventing those teeth from coming in, at least preventing them from coming in at the time that we would want them to come in. One of the most common extra teeth happens to form right in the middle of these front two big teeth. They're centrals, and sometimes that can get in the way of those permanent teeth from coming in. It can prevent them coming in, as you can see in this image. Sometimes it can prevent them coming in. Sometimes it comes in and you've got 3 teeth in the front, but that's the most common. That's the most common extra tooth, right in the middle in the top bone. So don't be surprised if your dentist or orthodontist tells you you have an extra tooth, and you can guess, be like, is it right in the middle on the top? You'll be so smart. So sometimes the dentist can see on the x-ray that you have extra teeth. Sometimes, because the permanent teeth don't come in at the expected time frame, that's what leads the dentist or the orthodontist to say, hey, maybe there's something that's blocking that normal pattern of eruption. So those are 2 ways that you can know if you have extra teeth. You can count your own teeth. You can see if some of your teeth are not coming in when they're supposed to. Sometimes you can Google those things. And if you're missing those teeth at that time, that could be an indication that you have something that's preventing them from coming down, like extra teeth. Or, and I think this is the best option, is you visit with your dentist or your local orthodontist to take proper x-rays and count teeth together to see if there is anything extra that might be getting in the way of normal tooth eruption. So what do you do? How do you take care of extra teeth? Most of the time, and this is the most common approach, when you have extra teeth, that those extra teeth end up just kind of getting in the way, or they can cause problems with teeth that are trying to come down, or the orthodontist wants to move your teeth, make your teeth straight, like beautiful and awesome, and they're afraid that those extra teeth are gonna get in the way of moving the teeth and could hurt the other teeth. So in either scenario, normally the plan is to get those extra teeth out, all right? And the orthodontist can coordinate with dentist or an oral surgeon to figure out which teeth are extra and which ones want to come out. I have seen, and you can see in this case, I worked with an oral surgeon to identify which teeth we wanted to take out in order to still get the teeth to be straight and the bite to be good. If there is a tooth, an extra tooth, that is in the way of permanent teeth coming into the mouth properly, whether or not you're actually ready for straightening your teeth and braces, it may be important to get that extra tooth out to allow for normal eruption, okay? Extraction is generally the approach. Get it out of the way. There are some people that leave their extra teeth alone and they don't need to move it or anything like that, and that's fine, and they watch it with the dentist or the oral surgeon just to make sure everything, nothing happens or becomes an issue. But if we're taking out the teeth, normally we're taking them out because we want to start straightening the teeth up and get the bite to fit together, and the extra teeth just get in the way. Or the extra teeth are preventing the permanent teeth from coming in, and that's a problem. And in that case, you may not be ready to start straightening your teeth, but we want to help the other teeth come in the way that they should. And so we say, hey, let's go get this tooth out of the way, and then we watch as those teeth come into place. Those are some ideas for you to consider, right? Do you have extra teeth? It could be you. You could be the one. We didn't talk about everything in all different scenarios. The best place for you to go for answers regarding your particular situation and if you have extra teeth is with your local orthodontist. Hope you liked the video about the extra teeth. If you liked the video, give us a thumbs up. And if you have any questions about extra teeth, if you were one of those fortunate souls, you can share your story. And of course, consider subscribing to our channel so that I can open your eyes to the wonderful world of straight teeth and beautiful bites. That's all I've got. Just a little PFOing so you know where you're going. Packard out.